Okay, I think we can go ahead and get started, especially since I know this is getting recorded. So as people trickle in, they'll be able to catch the beginning either later on or in another format. So first off, I'll say welcome, everybody, to welcome back to Advancing Criminal Justice Reform through a 21st Century Latinx Lens, a two-day summit being co-organized with a few different amazing organizations, UCLA, Drug Policy Alliance, and others that are participating in this expansive conversation about a number of different topics related to criminal legal reform and all of the challenges and nuances that have to do with from legal aspects to cultural ones. Really grateful that we have this amazing set of panelists today to discuss specifically the topic of drug decriminalization, which is something that has come up quite a bit in the last few years, especially as the consensus starts to build around.
Hey folks, apologies for the tech issues. We're going to ask you, Mael, if you can jump in and maybe use audio as a way to support with the streaming. But why don't we go ahead and do just a round of self-introductions, if that's okay, with our panelists, which organizations you represent and your intersection with this work in this space today. So we'll start to my left and we'll begin with Melissa Chavez.
Hi, everybody. My name is Melissa Chavez. I am the program director here at CHPLA, Community Health Project LA. We are needle exchange out here in Los Angeles, and I'm happy to be here.
Great. How about we move on to Melissa Moore next?
Sure. Happy to be part of like the double Melissa team on here today. My name is Melissa Moore. I'm with Drug Policy Alliance. I use she, her pronouns, and I'm the director of Civil Systems Reform, which is a mouthful that basically looks at the ways in which people end up being impacted and criminalized by the war on drugs across other systems outside of the criminal legal system. That tends to be what we kind of focus on and talk about, but there are huge impacts in people's lives across education and housing, immigration, of course, employment, child welfare, and on. So, really trying to draw out a lot of those nexus points and raise to the surface areas that have huge damaging effects for people and communities that we can address together. And I'll pass it over to Stephanie.
Thank you, Melissa, and thank you for having me. I am Stephanie Campos. I am the Director of Strategic Planning and Special Projects for Homeless Healthcare LA. In that capacity, I am the director of the Refresh Spot, which is a hygiene center in Skid Row, and it's around the corner from our syringe exchange, the Center for Harm Reduction. I also co-chair at the LA Central Providers Collaborative and have facilitated and chaired the LA Overdose Prevention Task Force for about 6 years. And I will pass it over to Lisa.
Hi, everyone. Glad to be here. Izzy, we're so much less moderate without you, without your moderating influence. I am the co-executive director for policy at the Public Defender Association in Seattle, soon to be renamed Purpose, Dignity, Action, because we no longer provide public defense services and haven't since 2013. We are project managers for the original law enforcement assisted diversion LEAD program. LEAD itself has been renamed as Let Everyone Advance with Dignity. There's someone needing some moderation right there. To signal that there are pathways into community-based care for people who engage in illegal activity related to drugs, apart from engagement with law enforcement. But we do still coordinate to accept diversion referrals from law enforcement locally. And that.
Hey, all, sorry about the tech issues. I'm gonna switch my provider and see if that'll help. Give me just a minute.
that model, the LEAD model, has been widely replicated in either its original police diversion, pre-arrest diversion framework, or in a direct community referral framework, as I just described, around the country and internationally. And so we provide technical support for that, which is effectively a de facto decriminalization model. I'll say more about that later in the hour.
Sorry about that. Some needed moderation all around. So while we're working on Ismail to join us, I'll start with our first question, and that is, despite the 50 years of prohibition, we have not stopped illicit trade. Drug use disorders and overdoses remain on the rise, and more people are using drugs than ever. How did we get here? And I don't know if any of our panelists want to start us off, and then we can kind of popcorn in that order. Melissa went off mic. Would you like to start us off?
Sure. I think, for me, when I think about that question, really it's I think it was systemic racism. I think that along the way, we've managed to dehumanize people along the way because of the systemic racism that exists currently. We've decriminalized drugs, and put governmental agencies in power that maybe didn't already exist, like the DEA, for example. That it became a very lucrative department along the way, and two, it really targeted individuals, marginalized individuals, people of color, Black folks, Latino folks, and I don't know. I just feel like because of that, that's how our history things started to unravel. And little by little, we saw people of color being targeted and arrested, and it led to the mass incarceration. And it led to, back in the day, drugs were illegal. Drugs are illegal, and people had access to it, and people were functional, and they got the prescriptions, and they were able to go to work every day. But when that became criminalized, it was people no longer had access to those substances, and people became desperate. And then you had people on the street selling drugs, and it became a way for our systems just to target these folks who had no other option. They had to continue using. People were hurting. People, they're withdrawing. They had no medical care to be able to attend to their substance use. So to me, that's kind of the history of how we got here. I can pass it on to Stephanie.
Thank you. I just want to add also, like the war on, it's been over 50 years on the war on drugs. I think that definitely plays into why we're here. And after all those decades, drug use hasn't gone down. It's actually increased substantially and created a massive illicit market. And it continues to promote violence and conflict and corruption. So, I mean, all of those things kind of have manifested to what we see here now, failed drug policies. And we know it's not working. So it's time to think about what we can do and talk about the decriminalization as a policy, legalization, regulation, what all of those mean for community, for people, for everyone.
As a follow-up question to that, for you all in your respective capacities in this really critical work, what does drug decriminalization actually mean, and why is it that people support it? And as a follow-up to that, what do you find to be some of the limitations to this work? Maybe we can begin with Lisa and Melissa and any others who'd like to chime in.
So much to be said in response to that question. I do think, bridging the first two questions, that it's important to recognize that we've actually never maintained a uniform approach to people's use of psychoactive substances. People with comparatively greater resources, race privilege, and proximity to power have never had their use of these substances actually responded to through the criminal legal system, even if there was the formal authority to do so. So I say that to say that under the high water, period of the war on drugs, that's never been equally administered. And in that realization lies some clues as to approaches that we can take to address and redress the harmful effects of using a criminal or punitive system to respond to people's use of substances to alleviate psychic and physical pain, which is why people use drugs. When we started LEAD back in 2011 and started working on it in 2008, so this is stretching way back and way before or considerably before the current opioid crisis and stimulant crisis and methamphetamine crisis. So we were really responding at the high water mark of the war on crack. That was the primary drug of arrest in Seattle when we got to work on this issue. What the community leaders so I was a public defender at that time and bringing a fairly strident and self-righteous framework to the work. I and my colleagues thought that what should happen in lieu of punitive and harmful measures was just cessation, that there should just be a moratorium on enforcement of low-level drug-related crime. And it was actually community leaders from the communities most affected by over-policing of these issues that came forward and said, that's the wrong demand. We're not interested in less of a response. We're interested in a different response, the same different response that white and affluent people have always had access to, which is access to care, access to social supports, and taking seriously the dynamics that are driving people not only to be using drugs, but also to be engaged in the drug economy, selling drugs on the corner. While we don't want our sons, daughters, cousins, mothers, fathers to be taken to prison, we also don't want people to be abandoned. And I'm going to come back to that word abandoned out on the street corner. We want to see a meaningful response to the circumstances that have driven people into the situation and real care. So that's what LEAD was organized to provide, that real care in lieu of jail and prosecution. And that, I think, is the key. I'll stop here. To whatever should come next, whether it's de facto decriminalization, which we can do today. There is no reason, even within the current formal legal structure, that discretion cannot be used to not do counterproductive measures and instead to connect people to good care. But whatever we do, it has to be more responsive to real harm than the present. The war on drugs is notable for its failure to make anything better. Much was made worse, and very little was made better ever by a punitive response. So it's not that hard to do better than the war on drugs, but I think that's where the decriminalization movement faces a test. Nationally, there's a tendency to think that when we talk about decriminalization, we're talking about stepping back from a problem. But one of the tenets of the harm reduction movement is to take harm seriously, and one can fully acknowledge the harm done by use of substances in an uncontrolled and unregulated context, including overdose death with safe supply problems and so on. And one can recognize the harm done to others through associated criminal activity within a criminalized context, and still say we take that harm seriously by wrapping community-based care around people and actually succeeding in reducing the harm and stabilizing folks. So I think that's the hallmark of public policy and where we need to go.
Thank you, Lisa. And Melissa, how about you? What does drug decriminalization mean in the spaces in which you work, and what are some of the limitations that you encounter in your daily work?
Yeah, I appreciate that. And I think, also kind of bridging the first question into this as well, because I think in order to provide policy solutions, recommendations to chart our course forward, we think we need to deeply understand what got us to this moment and what moment it really is, because there's been a lot of conversation around the opioid crisis among suburban people, among white presenting people, and even in that time frame when the media was really focusing on those specific demographics within and calling it an opioid crisis, there was a real ignoring of what the data were actually showing us. So prior to my current role, I was the New York State Director for the Drug Policy Alliance. And we actually looked at the data that was coming out of New York City. And what we see are these twin trends where the people who are most criminalized for drugs, despite the fact that people use at pretty similar rates across different racial and ethnic groups, are Black and Latinx New Yorkers consistently. I mean, at extreme levels, really intentionally targeted under the laws and the framework that we have right now. And it's the same folks that were absolutely not receiving the care that they needed to on the other side. And so, in the moment, as we saw, rising conversations about overdose deaths and about the need to do something, the dramatic rise all across New York City in the different boroughs, peculiarly and predictably, the borough like Staten Island that is predominantly white, although there are some communities of color on the island, but is perceived of as and known as a predominantly white borough, suddenly got a huge influx of resources. And the Bronx, where the actual numbers of overdose, not just the rate, but the numbers of people that we were losing unnecessarily were skyrocketing year after year, got next to nothing over and over again. And that's still the case. We've actually seen the rate and the numbers decrease pretty substantially in other parts of the city. And in the Bronx right now, if it was a state, it would be among the highest overdose in the entire United States. I mean, and it's not being talked about. And also there's this trend of especially Latinx New Yorkers being at the eye of the hurricane here. And that's not discussed whatsoever. And so as we're talking about what the solutions can be, all of the evidence is pointing to the fact that this doesn't work. If our goal is to actually keep people safe in the broadest context of that understanding, right? That means personal safety, community safety. We have to remove the potential for contact with law enforcement, with the criminal legal system, with all of the other surveillance and repercussions that come from criminalization. And also we need to, as folks have been saying, we need to shift all of the resources and the energy that goes into criminalization on the flip side, into actually building up communities and the support structures that already exist in community. People often know what they need, know what they want, know what would be helpful to folks, and don't necessarily have the resources to be able to put that into practice at the scale, to be able to meet the problem and to go and confront all of the problems that criminalization itself is driving within communities.
Thank you, Melissa. And I would love to pose the same question to Melissa Chavez and Stephanie Campos as well. I know you all do a lot of incredible work in the city of Los Angeles, which is a city that is 50% Latino, in a county that is 50% Latino, in a state that is 40% Latino. So I'm curious, in your work and in your interactions with both the Latino and immigrant community, how is the issue of drug criminalization perceived? What are the limitations for building support specifically within the Latino community for some of these efforts that you all are leading?
I can answer to that and then hand it over to Melissa. So I guess I can speak to the work in Skid Row specifically. I know that's it's a broader population here in LA and beyond, but a lot of the work we do, especially in terms of substance use and our syringe exchange and at the Refresh Spot, the hygiene center, we have an increasing Latino population that comes with a lot of barriers, especially for folks that are undocumented. And I think, just thinking back on how syringe exchange started, there is a sense of de facto decriminalization because it's very much done, from what I gather in our experiences here and what the staff inform us, is kind of what LAPD kind of wants to do. It's so much to their discretion to this day on all fronts, especially that our clients are still getting their naloxone confiscated syringes. It's a lot less common than it used to be, which, I mean, it's totally legal to carry syringes, used, new. Naloxone, of course, it's a life-saving medication that anyone can, and should have, and it's super safe to use. So it's, in Skid Row, I think we've done a lot of advocacy work. So there is a form that things are some I guess, having paraphernalia that's been decriminalized, and it's not pushed as much as we've seen it over the years. And, when I started homeless healthcare over 7 years ago, no one wanted to carry naloxone. LAPD, Sheriff's Department, no one, they saw it as a liability, and it took so much work just to get them to agree. And oftentimes they're first responders now, whether they want to be or don't want to be, but that is the case, and that's what we're seeing. So I think that when it comes to decriminalization, at least de facto, I think that is like maybe easier in some forms to grab onto for Skid Row purposes, especially because there's been a lot of movement on maybe overdose prevention sites. They opened a few in New York and kind of those innovative approaches. But in other communities, I feel like it would be really, really challenging. I think, I don't know if Melissa, like more on the West End, or like you want to speak to kind of what you're seeing over there.
No, 100% what you're saying. I agree with you. I think first and foremost, one of our biggest issues that we see, I mean, granted, we are a needle exchange, and we're constantly having to educate our participants and constantly having to educate our LAPD and sheriffs. I mean, on what's legal, what's not, what you can harass our clients about, educating our participants really what their rights are. It's been a constant thing because they don't, there was a time where they didn't want to, just like Stephanie said, they didn't want to accept syringes. They didn't want to accept naloxone. Now it's become, because of the education that we provide into the community, it's become easier for them to take to access our services. I mean, there was a point in time where they didn't even want to be near us. So they're like, oh, needle exchange. Let me just stay away, because if I'm near, the mobile unit, then it says that I'm associated with the needle exchange. And so we really had to do a lot of education. We also focus a lot here specifically. We focus a lot with educating other providers about the laws and about naloxone and about substance use disorder. And it's fascinating to see that other providers are very, and when I mean other providers, I mean mental health clinics, I mean housing agencies. These are all people who work with people experiencing homelessness. Right? These are all people who work with people who are using drugs. And it was fascinating to see that along the way, it was very linear. The services were very linear, and they didn't understand what it was for substance users and what their rights were. And there was a lot of dehumanizing, a lot of ridicule that went towards these folks who were trying to receive services. We hear quite often that people don't want to go access services. They don't want mental health services. They don't want to deal with housing organizations. And a lot of it is because they're treated very, very cruelly, and if you think about substance use in general, there's layers and layers of trauma behind it. So to have to go and seek services and then to be knocked down because you're not sober, or because you're being honest and saying, you know what, I don't think I can kick this right away. I need to be able to use. But yet at the same time, they're not accepted into services, because one of those things is abstinence, let's say, and mental health workers don't want to work with them because they're not sober. People forget that there's multi-layers here. And when we work with these folks and people who use drugs, it's not linear. We have to be multidimensional. It has to be syringe exchanges. There has to be trauma-informed care. There has to be housing. All of this needs to come together simultaneously, and it doesn't. And that's one of the issues we see. Granted, decriminalization helps our folks with staying out of jail. Maybe they're not being arrested for carrying syringes anymore. But that's taken years and years of education. And Lisa, to your point, we also have LEAD under our program. Under CHPLA, we have a LEAD program, and we do see how it's effective, and we do believe in diversion. But one of the things that we have seen and that we've had to do quite often is educate our LAPD officers on what lead is and get their buy-in, because otherwise they're not diverting. They're not diverting clients to us. They're not diverting people who use drugs to us. So it's been a long time. I think, when you have services like safe consumption sites, for example, substances are being controlled. We know that people need them. But it can keep hospitalizations down. If people had a hub to go to receive safe services, where they're monitored, and at the same time there's additional like supplemental services like therapy and services focusing on the trauma. I mean, there's so much that can happen in those scenarios. It reduces the overdose deaths. It reduces all of these 911 calls coming out and attending to people who are overdosing. People are healthier because they're utilizing safely, and they're not rushing and hiding and doing all of these things that they need to do in order to use and to get what they need. So yeah, that's kind of where I go with all of this.
Thank you, Melissa. And I want to welcome back our principal moderator, Ismail. I know you're having a little bit of tech issues, but happy to step in here and support you. We are a community after all. There was a question that Lisa posed that I think would be important to speak to, and then we can transition back to some of the prepared questions. And that is, what are the benefits of drug decriminalization as it relates to the added immigration consequences that many in the Latino immigrant community experience when they interact with the criminal justice system? So I'm not sure, Lisa, if you wanted to get us started, and then we can continue on with Ismail and leading us to the rest of the questions. Thank you.
I did just want to make sure that, first of all, could not agree more with everything that Melissa just said. So to have an alternative that is more, not less, we need so many things that are generally not at the disposal of community-based organizations. So there's nothing, I have rarely seen anyone, whether it's people who like to call 911 about drug users or police officers themselves, who aren't perfectly willing to have an alternative community-based response, as long as it comes and as long as it's effective. Because people have a bias toward action, and in our society, the only way that we make it possible to request action in response to public order issues is to call the police, and our alternatives are not scaled to provide that kind of system response. And even if we come, we don't have a place to offer for people to go, and the kind of meaningful, impactful services that really make a difference on the street are rarely at our disposal. When you scale those resources, it is impactful, and police can see that, and the people who call 911 can see that, and the uptake is high. So that's really the battle, is to do that scaling of something that comes and makes a tangible difference right away. And it's very theoretically very easy, and on the ground just not resourced to have that play out. But I did want to not let that point about immigration consequences be lost. For folks in the audience who are not already intimately familiar with this, entry into the criminal legal system, including just a detention facility, is one of the greatest risk factors for adverse immigration consequences, regardless of how that case ends up playing out. Almost all court-involved resolutions, even if they're court-led diversions, trigger some level of adverse immigration consequences for individuals, which obviously has a ripple effect on family members who had nothing to do with any wrongdoing whatsoever, are not drug users, but it's their parents, it's their children, it's their siblings who are permanently removed or can't adjust status or are not eligible for DACA. So any strong resolution to drug-related harms that doesn't involve detention and the formal legal system is advantageous to family members and advantageous to preserving that person's ability to recover, stabilize, and have a connected life. And that can be accomplished through de facto or formal decriminalization strategies. But it's just naming this to leave it for future discussion. There can be adverse immigration consequences too to publicly funded care strategies that are not framed thoughtfully to avoid public charge or other analysis later when there's discretionary action on adjusting status and so on. So it's very important to frame whatever we do so that it doesn't send signals later in discretionary immigration decision-making contexts to deny benefits to folks and their families. And people know how to do this. So if there are folks listening who are ready to frame up an alternative, remembering that this is one of the important questions is just very valuable at a policy level.
Yeah, I'll just piggyback on that. I mean, I think the work of especially the Immigrant Defense Project has been really crucial here in really raising up a lot of those points that Lisa was talking about through other policymaking channels, and really centering the fact that because of federal prohibition, even in states with legal cannabis access, for example, people who have status issues with their immigration can still be penalized and can still be deported and can still have really extreme consequences come down on them. So always bearing that in mind and always lifting that up within these conversations is absolutely crucial. And at the same time, going back to sort of our earlier thread, I think, the upshot of decriminalization is that it can be a way to begin disentangling this knot that we've gotten ourselves into, and the way that the drug war, really like the tentacles of this beast, have wound itself around very intentionally, right? Like, I don't say wound itself around in like a passive way. Like, this has been constructed in this way to impact every aspect of people's lives. And decriminalization, while helpful in sort of at least putting a bit of hopefully a block or a decrease on, the front door of people being ensnared in the criminal legal system, if we're not doing the rest of the work to disentangle what the impacts are for people, if we're not arresting folks who are struggling with problematic drug use. And that's also, let's be clear, not everybody who uses drugs is struggling, right? Like, we know that there's a vast population of people who use substances who don't have a chaotic use or a chaotic relationship with that substance, and yet can be criminalized just the same. But if we're talking about the population of people who are in a problematic relationship, just the fact that we're going to stop criminalizing is important and is crucial, and we should move in that direction. But it doesn't address safe supply necessarily. Overdose prevention centers, as we've seen established in New York with On Point, are beginning to try to tie that together, at least with more fentanyl testing. There hopefully soon will actually be much better drug testing services with like a mass spectrometer, like an actual machine that can look at the potency of fentanyl, not just the presence, for people to be able to make informed decisions and to be able to dose properly. But we're still a far cry from that being implemented as it should be all across the country. So what do we do in the meantime? How are we going to shift resources in a way that moves from this sort of criminalization framework and the punitive framework that's rooted in? Like, even if we're talking about decriminalization, there's still so much of like a moral stigma around people who use drugs. And until we really shift that narrative and that understanding, we're still going to be entangled in this sort of concept where, even within the conversation in Oregon around Measure 110, which was groundbreaking, which decriminalized personal possession of drug use, there was still a strong pushback of people saying, well, fine, we can decriminalize drug use. We understand that that's not an evidence-based policy. Everything is showing us that this is not improving outcomes for people. We need to move away from it. But the sort of knee-jerk response from actually a lot of folks was, well, then we need to mandate people into treatment. There has to be something. People can't just go scot-free, right? There have to be consequences. And not understanding that consequences are almost the antithesis of the care that people need, right? And so being able to flip the entire conversation toward care, toward compassion, toward harm reduction, and actually meeting people where they're at, and not just always coming through this punitive lens, whether it's the criminal legal system or whether it's some other system. We can't replicate that sort of policing and the surveillance and the tactics of the drug war in the criminal legal system just by another name. We have to actually disrupt that.
Yeah. Thank you for all these important points. And thank you all for bearing with me while I have the worst tech issues I've had, like in this whole pandemic, apparently. But I wanted to just touch on a little bit of what really all of you have said, but especially you just used the kind of framing, Melissa, of like, it's like wrapped itself, this drug war has wrapped itself into so many aspects of our society. And I heard that also what Melissa was saying, and Lisa and others. And I kind of want to go into this idea that I feel like kind of problematic drug use and the way that society talks about drugs and drug use seems to be a little bit of a scapegoat for these other huge problems in society that are much bigger than just the ingestion of a substance. But I also want to get to some of the concerns that people have because it reflects these larger issues of society. And when people talk about decriminalization, especially when they're not super familiar with it or familiar with these larger social questions, their first thing is, well, what about violent crime? What about hospitalizations? What about open drug dealing? What about these secondary effects that people are afraid of? So I'm wondering if folks could talk a bit about how you or we respond to some of these concerns around where will society go if we suddenly remove the consequences? What will actually happen?
Well, any proposal to decriminalize or legalize drugs, drug use, drug distribution, none of that entails decriminalization of any of these connected behaviors that are either factually or in the popular imagination associated with the drug economy. There's no decriminalization of violence. There's no decriminalization of property crime proposed. And I think the key point, again, this is why I come back to the very simple concept that proposals to shift away from a punitive, criminalized response to the drug activity should be about more of a response to those harms, not less of a response. They do not come from a theory that there are not serious problems associated with drug use in our society. They come out of a recognition that there are serious problems associated with drug use in our society. So people wanting a real intervention that is helpful and conducive to recovery, stabilization, and healing, and a reduction in those associated harms. Just to be super concrete, and I have appreciated that the other panelists have been concrete, and I realize I haven't super been, so I'm going to try to be. I think one of the greatest benefits of a shift away from criminal penalties for suspected drug use or distribution is that people involved in that activity can speak openly and honestly, both with caregivers and with the law enforcement representatives who are going to encounter folks. I mean, there are going to be those interactions. When they happen, can a police officer sort of get a quick update on like how is it going? What's kind of how's your struggle going? And if the individual who's still stuck in sort of the early stages of recovery, trying to gather the momentum, strength, resolve to tackle some really hard things, including sometimes not using illegal substances, can report honestly on what are the barriers. Then the officer or prosecutor or whoever it is, instead of inadvertently making that harder or unraveling, pulling the rug out from under somebody just as they are on the verge of getting housed, on the verge of getting other care, on the verge of getting dentures, on the verge of getting a job, can reinforce and support that, which should be the mission of law enforcement. It should be the mission of prosecutors. And with good exchange of information, it can be, but nobody's going to provide that information if they can't be truthful without criminal consequences. I will never forget an officer who talked about, he had made a referral of an active user to lead, but he wasn't sure why he was still seeing the person out there. After all, he had done his part. He had connected the person to services. Once that officer understood that that individual who was living in a tent was on a wait list for our coordinated entry program and was looking at a 7-year wait for housing, all of a sudden, instead of being critical of this person's survival struggle, they became a supporter, because it was astonishing to think that that was the best that we could offer this person, who was doing everything that anyone could ask. So that kind of, creating a context in which everyone who touches a life can be on the same side supporting stabilization and recovery is one of the strongest reasons for a paradigm shift away from criminal punishment.
Yeah, thank you. I love that you touched on like not just the actual experience of the people who are struggling, and I like the point that was made earlier that not all people who use drugs are struggling, but I do appreciate how just that little extra window into what's like really going on, what's underlying, whether it's the inability to access services or so on, is such a significant piece. Would anyone else like to comment on this question of like, whenever I talk about drug decrim in my own work or anything, the first thing people say is like, what about the drug dealing? Well, what about the open drug dealing? What happens when you do that? And then suddenly you have regular sort of structure around it. But I wonder if anyone would like to say a little bit more about that.
Sorry, you were cutting out again a little bit, Izzy, but I
Sorry.
think no, you're good. I think I got the gist of it. I want to also kind of loop back to what you were saying before, because I think it's tied together about drugs being the scapegoat for social ills. I think like there was an example of this even very recently with the Sam Quinones book. It's talking about the rise of a new type of meth, and like kind of going into what the implications of that are, and basically laying the entire like the population of people who are unstably housed, especially in Southern California and in LA, at the feet of this new formulation of methamphetamine, and ignoring the fact that there has been like complete disinvestment in social systems, support structures for people to be able to get housing, rampant gentrification, multiple economic collapses that have led to people losing their jobs, instability, that all of these factors. But instead it's like, oh well, people are using this different type of methamphetamine, so that's why their life went off the rails, and that's why they're unstably housed, ignoring the actual experiences that so many people have had where all of these other things happen to them first. And then as a coping mechanism, as a survival tactic in a lot of cases, because people are on the street and worried, rightfully so, about being attacked or having other things happen to them, they might use a stimulant to be able to stay awake as part of a coping strategy. So ignoring the actual very logical reasons why somebody in that situation might be using a stimulant in that case, but instead just saying like, this is the entire root of the problem, and not problematizing, not investigating, not interrogating all of the other ways that society has been completely, has markedly been absent in doing anything to solve problems that people are experiencing, and in so many ways exacerbating the problems that people are experiencing. And we see that also with people talking about people who are selling drugs, right? And just, immediately trying to draw the line and the distinction between people who have, personal possession quantities of drugs versus people who are selling drugs, talking about kingpins, the fact that we see lawmakers in one breath talking about, we shouldn't be arresting people. We can't arrest our way out of this problem. We have to move differently. We need to deal with overdose deaths. And then at the same time being like, yeah, but we should do drug-induced homicide laws, and we should, prosecute people who sell drugs to the fullest extent of the law, not understanding how intertwined those things are, and how, some people who sell drugs are blocked out of jobs in the formal economy. These are people with tremendous entrepreneurial skills that, with other life circumstances, with other opportunities, could have been CEOs of Fortune 500 companies, clearly, right? Like there's a tremendous acumen, but there's been this complete roadblock there. So I think, you know, again, like these binaries that you're lifting up so often do us such a disservice. And the reductivist sort of laying all of the social problems that we're dealing with right now at the feet of people who use drugs, or as we're seeing in San Francisco, at the feet of like harm reduction in this like very twisted drug war logic sort of way. I think, you know,
Right.
it's really on people to like interrogate those very simplistic frames a lot further.
You just did a great job of like elucidating that paradox. So thank you. And Stephanie, I noticed that you had unmuted earlier. Did you want to add something to that?
Yes, thank you. So just on a quick note, in terms of the benefits of decriminalization, on the macro level, it's just when you're able to shift or change people's perception about the way they see drugs, or people that use drugs, and drugs not being treated as a criminal issue, but more of a health and social one, that really paves the road for so much to happen, and just reduce that stigma. So people often ask me, like, what's the hardest part of your job? I always say it's the NIMBYism, of course, for me, at least my experiences, and the stigma around substance use, homelessness, mental health. And I mean, a lot of our clients, you know, they hit a lot of that, and it's a huge barrier. So any way that we can just shift things, or it's gonna, I mean, I don't know how long it might take to get there, hopefully sooner than later, but on a macro level, like that would just be immensely helpful. And then on the ground level, it just, people may be encouraged to call 911 for emergency situations, overdoses, like that's not happening right now. People are very much scared, even with the Good Samaritan law. Like people are still very much afraid, or reducing HIV, HCV, all kind of communicable diseases. Like all of these things would happen in more of on the sooner side, but just on a macro level, any way we can just peg away at shifting people's perception and reducing that stigma, I think would just be super helpful.
Absolutely. The stigma factor is important. And then Melissa, did you want to add something, or do you feel complete with that? I just noticed you also.
No, I really, you know, I really appreciate what everybody is saying here. And honestly, like what we see day in and day out in the services we provide, again, we're a needle exchange. So we service people who are waiting on other systems to kind of come together. When you look at all of this, so I think of there needs to be a holistic approach when we're dealing with people who are experiencing homelessness, and when we're dealing with people who use drugs. And what I mean by that really is, yes, okay, needle exchanges are great, okay, but then you have your mental health systems, and then you have your housing systems, and all of these systems that are in place. Granted, they're in place, but they're not in place for the people that we're serving out on the street. They're not equipped to handle people who are using drugs or people who are experiencing homelessness. They're not understanding all the victims. You know, a lot of the people experiencing homelessness, they are victims of crimes. There's so much crime that is happening out there when you're on the street that people don't realize, and it interferes and it creates barriers to services, you know. And when you think about all of these wait lists, you know, to get housing and stuff, we deal with housing providers pretty often, and a lot of them they don't understand the population, in the sense that this population, it takes time and it takes effort, and it's ongoing effort. It's not like, oh, well, I went to go see this person and, well, they didn't respond or they weren't there, so, you know, case closed. So there's no sense of understanding that it takes time, and it takes being trauma informed and how to deal with these folks. So to me, I don't know. I always go back to a holistic approach, and like this is the best way to be able to handle folks who are experiencing homelessness, who are using drugs, and it takes a system together to be able to manage these folks and to be able to truly provide services that are really needed. So I don't know, that's just something that we really take pride in, and it's something that we see day in and day out with our clients, and we're constantly hearing, you know, how they're being stigmatized and how service providers are not responsive and how they're being mistreated, how they go and seek medical care and they're being dehumanized by the same folks where they're just trying to get better, you know. So it's very hard to be able to uplift the people that we're serving and to kind of just keep them going in their day in, day out routines. So I just wanted to add that. Thank you.
Great, thank you all. And just as we prepare to close out, I was hoping if we can maybe touch on one final question for our panelists, and that is, in your work in the regions and jurisdictions in which you provide services and advocate, what successes and challenges have we seen in cities and states and countries also that have embraced drug decriminalization that we can elevate as sort of spotlights and interventions to look forward to?
I can jump in super quick, and I'll be fast since I know we're coming up on the time. You know, I think it's interesting, you know, looking at sort of the global context, you know, people often point to the experience of Portugal, where, you know, they decriminalized at a point when they decriminalized drug possession at a point when, you know, the country was experiencing some of the highest HIV rates in Western Europe, some of the highest overdose rates in Western Europe. And the outcome from that now, you know, more than a decade on, has been Portugal being some of the lowest rates in both of those areas. You know, a real significant outcome change in some of these key markers and key metrics. But I think, you know, trying to just translate that experience directly into the US ends up getting us in trouble, right? Because the context is so different. Like here, the fact that people don't have access to healthcare in so many different situations is a major difference and barrier. Like in New York State, you know, kind of bringing it back home, buprenorphine and other, you know, forms of medication assisted treatment, or, you know, medications for opioid use disorder were not available, or there were severe challenges and roadblocks to New Yorkers who are on Medicaid accessing those medications up until we passed the bill to address that this past legislative session. You know, syringes were still criminalized in New York State up until we passed the bill this last legislative session after a 10-year fight. You know, there are just such tangible changes across so many different systems that need to be made in order to tie this together. You know, I think going back, you know, drawing on what Melissa was just saying about the dehumanization that people experience, I think decrim, as we're looking at these different models and different experiences in different places, what really comes home for me is decrim has to be paired with an active effort to tear down the practices that dehumanize people, and also combined with investments in the dignity of individuals and communities, and people's right to determine for themselves what is actually going to be the most functional.
Would any other panelists like to share one final parting thought?
I'll just say that anywhere that community and public officials have joined together to create an alternative response strategy for drug-related harm, it has been wildly popular. There is a cross-ideological, enormous base of support for that shift around this country in rural, urban, red, blue areas. It's very popular and including with law enforcement, but it is engineering that and making the alternative be real is the challenge. I just want everybody listening to know that there is no way, we cannot turn back. The war on drugs is over one way or the other. We have to do something different. But those of us who champion that really will, you know, run the risk of disappointing the potential of that move if we do not take seriously the scale of the alternative that is needed. And everybody on this panel is doing that admirably. But we need to be thinking on the same scale as the war on drugs operated. We need to respond differently, but at that
level, I think was her concluding thought there. So I appreciate that last sentiment around the proportionality which we need to respond in order to move the needle here and make progress for our communities. And so with that, I would love again to thank our panelists, Melissa Chavez, Melissa Moore, Stephanie Campos, Lisa, and Ismael for your contributions, the really incredible insights that you shared with our audience today. And I just wanted to note for our participants that we, in closing out the 2-day convening, will be having a breakout session immediately following this session, where we hope to continue these conversations and really put pen to paper and think about how these discussions, these insights could be leveraged to identifying shared policy strategies, campaigns, legislative proposals that are bright spots throughout the country that we can sort of unify in a shared set of policy priorities. So we invite you all to participate in that session. In order to navigate there, you're welcome to go back to the reception, and through the sessions link can select from a variety of different sessions to participate in for these breakout discussions. But with that, thank you all again, and I hope you enjoy the remainder of your convening.
Thank you. Thank you for having me.
Awesome. Thank you.
Have a great day, everyone.